We're going to be talking about men's mental health, the sort of problems that can arise around this topic, how we can overcome certain barriers that stop men accessing support, how we can best help men who might be struggling with their mental health. Men's mental health is really important to talk about. We know historically notions of masculinity have made it difficult for men to open up and talk about how they feel. We want men to know that support is out there. You may feel, you might be having a really difficult time right now, but support is available. Having conversations like this is our way to kind of reach more people so men know that they can access support, and it's okay to do so, and it's good to do so. The traditional kind of perspective of a man and what a man should be is strong, the breadwinner, the one who protects the family unit, for example. And how we've seen mental health societally for so long is mental health equals weakness. So those kind of values, the way we see mental health is changing, but it's still very difficult for a lot of men to start talking about, how they feel, what's going on in their life because of that historic kind of approach to mental health. Stigma is a significant barrier for men accessing support. Again, whether it's related to how they're perceived by friends, how they're perceived by loved ones like family, for example. Those factors will often make it really difficult for a man to open up about their mental health, about their feelings. Again, that perception of weakness. I have to be strong. If I show any sign of emotion or anything like that, then I will be deemed either weak or a failure. And if you hold that pressure, it's quite a lot to hold on your shoulders, isn't it? To not be able to talk about how you feel. That's an additional internal pressure that we put on ourselves. In reality, we know that emotions are a completely natural human thing to experience. We all experience emotions. We experience them in different ways. But historically, men have been told, don't show this, suppress this feeling, deal with it, man up. It will always depend on the context that you're trying to support someone in. It'll be different if it's a loved one to someone in your office that you're working with. They often say, don't they, ask and ask again. So, how are you doing? Quite often our default response is, I'm fine, thanks. How are you? And we just crack on with the day. But if we ask again, and actually, how are you really? Because I know that you've been struggling lately, and I'm here to chat. So that's one thing we can do. Just making that individual as well know that you are there to talk. You might not feel like talking right now, but just know that I'm here for you if you need me. So you're making yourself accessible, you're making yourself available in a really supportive, healthy capacity, basically. One way to make it a little bit easier for people to talk about mental health, a little bit less intense way to start this kind of conversation is to maybe suggest just a walk around the block, depending on the context you're in. It doesn't have to be a very long walk, it doesn't have to be going out to the countryside or anything like that. It's more about just making sure the person who is struggling feels confident and comfortable. And one of the things about walking, it gets the blood flowing. That in itself, being outside, that fresh air, that is good, that's calming for us, that calms our body down. That will make it easier to have a conversation anyway. But obviously when we're walking, we're looking generally ahead. So the eye contact is reduced by that, which is nice, isn't it? Because when we're having conversations that are emotional, they're emotive conversations, intense eye contact can be a little bit too much. So the idea you're walking side by side, you're looking ahead, can take that edge off and make it just a little bit more comfortable for someone who might want to open up. Encouraging help-seeking behaviors is a really good thing to do to a man who might be struggling with their mental health, because their natural inclination might be, I'm going to just push through this. I'm not, I don't need help. I'm a tough guy. I'm just going to be all right. I'll be fine. It will pass. Well, actually, we know that sometimes if we leave difficulties, they can develop, they can get worse. So actually, when we're encouraging help-seeking behaviors, we're sort of saying, have you spoken to anyone about this? Have you thought about speaking to your GP? We know that they can help. Have you thought about accessing some kind of therapy? You're just reminding that person that there is help available, there's professional help available, and it is accessible. It might not just be around professional help. It might be like, checking in. Are you looking after yourself? The key things that we all need as human beings, we need to be eating regularly. Are you having regular meals? We need sleep. Are you making sure you're getting enough sleep? Are you going to bed early enough? Are you well rested? And we need some physical activity in our lives. We're all different. We need different levels of physical activity, but we do need some level of physical activity. So, are you getting out at all? If you know that person, it's easier because you might know their hobbies or interests. For example, I know you used to go running. Do you still do that? Does that help? Those kind of things, and just encouraging that individual to think about the basics. What can I start to do? Little changes. What can I start to do to help myself as well?